this is Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas. See, I can't even say that, and I've said it a million times. In any case, we're here at Cup of Joe to talk about healthcare topics. And as you know from listening to Dr. Tong last week, we are in National Women's Health Month. And our Chief Nursing Officer, Rhonda Mayfield, is joining me again to talk about this and talk about not only the importance of women getting the sort of preventative health that they need, which we've heard from Dr. Tong, but I'd love to hear it from a nurse's standpoint, and how that connects to our upcoming Power of the Purse event on May 29th at Pecan Grove Country Club, which I'm really excited about. It's a significant, fun event for us, and we have some wonderful speakers. We have Dr. Tong, Dr. Stammen, Dr. Lebrano, and nurse practitioner Shyla, who will be talking to us about women's health. So tell us a little bit about, let's start off with, why is National Women's Health Month important from your standpoint as our Chief Nursing Officer and a member of the nursing profession for more years than we care to count?
A minute.
A minute. All right, let's go with it. All right.
So women's health is very important. I'm glad that nationally we are recognizing that now. So for sure around mammography services, making sure that we're detecting breast cancer early instead of later, so that we can increase or decrease the mortality risk around that. Making sure that we're helping ladies transition through their different phases of life in the most easily way possible, making sure that we're going to see our checkups, we're going to do our pap smears, we're going to do our breast exams, we're getting our hormones checked, we're getting our thyroid levels checked, we're getting our heart checked out.
So let me jump in here, Rick, because this is a lot what Dr. Tong said, so I don't want to kind of go over what she said, but what do you see as to barriers as to why women don't do this? Dr. Tong talked about women have these other responsibilities and they focus on that, and they just don't find the time to get in to see their doctor. Do you see any other causes that lead women to kind of not do some of the preventative care that they should be doing for their own health?
I do. There's different barriers for different reasons, whether it's socioeconomic reasons, they can't afford to, they can't take off work, or up to the very, very busy career person that if they take off and they're outside of their line of work for any amount of time, their work suffers. So it ranges from those different aspects for sure. But also now, menopause has been such a contentious topic over the years. People make fun of it and make light of it and things like that. And now I love to see that we're sort of transitioning to really recognize that it is a very, very difficult time in a woman's life. And so I think that folks shied away from talking about how they feel and all the changes that are happening within their body. And now I love to see that we're sort of transitioning out of that to where we are able to talk about it, and there are things that we can do about it to make it a lot more easy as we transition out of that.
So there's some topics that have kind of been, don't go there, no fly zones for society as a whole, and that influences women to kind of downplay their importance until the consequences are significant.
Absolutely. And Power of the Purse is a way for us to be able, yes, it's a fun time. Yes, we play bingo. Yes, we, love to eat and fellowship and drink and have a good time. But the whole purpose of that allows us to fundraise money so that we can put into women's health, like making sure that we have 3D mammography, the highest technology to be able to take care of women to detect breast cancer, making sure that Dr. Tong and Dr. Stammen have what they need at all times to make sure that we're taking care of the ladies like we need to.
So you have a unique position to talk about women's health, not simply from a clinical standpoint, but as a leader of what is largely a women's health, a women's workforce. I mean, hospitals have a majority of women working in the environment. So what do you see out of our workforce that if you could say, guys, you need to do this, what would you be telling our workforce?
The main thing that I would say is take care of yourself, take care of yourself, take care of yourself.
Only 3 things.
Only 3 things. Only 3 things. So, when I've been a nurse for a long time. 26 years.
26 years, okay.
When I was a young nurse growing up, we used to pride ourselves on being able to go a whole 12-hour shift without going to the bathroom.
Oh,
and
yes,
so now
great
that
idea.
now that I'm a little older, there's consequences to that.
Yes.
And so that's probably the biggest thing, the biggest piece of advice is take a break, take a minute. If you got to walk around the building during the day, take a minute. Take care of each other, make sure that you're working with a team where you love each other and you help take care of each other and you're able to tap in and out and just talk to each other about, debrief during hard moments and things like that.
Take care of yourself, take care of yourself. Kind of like the rule in real estate, location, location, location.
That's
in your
right.
case, take care of yourself.
For
so
sure.
As we get ready to get to our Power of the Purse, I understand there's some new aspects we've added to the Power of the Purse. Can you tell us a little bit about those?
Sure. So we we have sponsored tables, and those sponsors get special treatment, if you will. They get everyone gets the dinner that comes with their ticket, but they get goodies and wine, and they also get extra bingo tickets. So there's lots and lots of great purses, lots and lots of great prizes. So we've got Kate Spade purses, Louis Vuitton purses, Dooney and Burke, of course. Coach, all the major name brands were able to get and come together and have a little fun and play games and win some purses.
And I understand we got a photo booth making its appearance this year. Which is always fun. My wife and I collect a photo from every event we go to, and we keep it together just as a reminder of where we've been. And then we have a few raffles, I understand, that's new to the event, so that's really exciting, including some random raffles, some social media raffles. So it should be a lot of fun. I'm looking really forward to it. I've always enjoyed it. And so thank you very much for being a part of this event, and most importantly for leading our organization and for explaining to us the importance of National Women's Health Month. See, I can't even say it at the end of the day. So thank you all for joining us for another Cup of Joe, and we'll look forward to seeing you soon.